scores of patients and staff coming into contact with that doctor. What are those numbers looking like?
Well, Shahan, what we're learning this afternoon from the Deputy Health Minister, of course, with some of the officials from the Northwest, is that there are about 56 patients that had been seen by this doctor, a gynecologist to be exact, Shahan. And of course, he worked in 3 hospitals, private hospitals, that is here in Klerksdorp. So he has been seeing many patients, 50 of them, 56 of them to be quite exact, Shahan. And what officials are telling us this afternoon is that 50 of them have since been traced, but they're still outstanding 6 that are still, that they're still looking for at this stage. They're still trying to make contact with some of those patients. But not only that, we also do understand that there's also about 44 staff members that this doctor had been in contact with in the 3 hospitals. So the numbers they're saying, Shahan, at this stage, those are the numbers, 44 workers to be exact, and also about 56 of those patients. Of course, the issue of the contact tracing, they say that is underway. They started that immediately after receiving the test this weekend. They've also gone to try and disinfect the hospital and especially the areas of practice where this doctor had been working. But let's take a listen to what the official had to say on this issue, Shahan.
Out of the 56 patients, they've been able to get 50. They are following up on the 6. So our team from the province will be working with the private hospital here to make sure that also the 6 can be found, and necessary steps are being taken in terms of making sure that all the 44 staff members are in isolation, self-quarantine. Those who have facilities, those who don't have facilities are being looked after by the state, and then the same thing with the patients. And the steps which they have taken also to decontaminate the various health facilities in the 3 hospitals, the maternity wards, the theatres, and all that. So we're satisfied with the intervention which they have made.
Speak more about the contact tracing. How far into the screening are they going to go?
Well, Shahan, what we're hearing at this stage is that they've managed only to trace those that have been in contact with the doctor. So we did raise this question as to whether they will also be, reaching out to sort of relatives and family members of those people that had been in contact with the doctor, or even if they're going to be screening other healthcare workers at these 3 facilities. So what they're telling us at this stage, Shahan, is that their focus is still on this group of those who have been identified as being in contact or direct contact with the doctor. So at this stage, they're saying that they're not, looking at the secondary cases so far. So they're dealing only with these specific numbers, and those are the people that have so far been self-isolated. They've been sent under quarantine, some of them in government quarantine facilities. But we do understand that the doctor himself is being quarantined here at one of the hospitals where he was working previously. So they're saying that at this stage there's no cause for panic, but of course they'll be monitoring to see what those test results will come out. They've all been tested at this stage, and they're still awaiting the test results of those particular patients as well as the workers. So should any of them test positive, they say then they'll only then consider reaching out to other people who might have been in contact with them following those test results.
And what's the province saying about its state of readiness to deal with COVID-19 and its spreading?
Well, Shahan, we did pose this question, and what they're telling us is that currently they do have facilities to send those who have tested positive for the virus in self-quarantine. Of course, one of them being in Rustenburg, and the provincial hospital here in Klerksdorp being the hospital that has been identified to deal specifically with COVID-19 cases. But as we speak, Shahan, the Deputy Minister as well as the MEC for Health here, Madoda Sambata, have now gone to inspect 2 of the facilities. Those are the extra facilities that have now been prepared to try and deal with the cases in the event that there should be, an overwhelming number of cases being reported. So they are going to monitor 2 mine hospitals, one of them being in the Westville, not far from where we are. It's about 20 minutes away from here. And they're saying that this is one of the facilities which will be able then to house some of those patients should the numbers increase. And of course, they're saying that in terms of their numbers and in terms of facilities, the resources that they have, they believe that they have enough resources and that they are ready to deal with the pandemic should it reach that point.
All right, we'll leave it right there. Thanks for the update. Manqoba Mchunu.